Hello. Okay, so I'm rewinding the daily St. Michael Basilica Mass. It's a nice, sweet, darling elderly gentleman. I should be praying the Mass, but I just wanted to give you an update because um, I wanted to let you know that I was able to get to my feeding tube replaced. Thanks be to God. My prayers work, and giving it all to God is always the way to go when you're feeling at the end of your rope and completely unheard and like nobody understands where you're coming from. And you just have to be patient, practice patience, perseverance. I might have to go to confession based on my own personal evaluation of the way I behaved, go walking into that emergency room the other day. I'm not going to take them off the hook, however, because I was validated in many ways that my perception of what I was experiencing at my local hospital is actually not far from the truth, sadly. But my hope is the Canadians are starting to wake up, and they're no longer able to keep the scourge that the emergency room staff have been in new policies have been inflicting on both staff and patients at the local hospitals in Canada quite anymore because it's that like with all secrets they sort of bubble up to the top and just because you know an emergency areas in most hospitals across I don't know what the system is in the rest of the world, but in Canada the emergency department is like a little mini hospital of itself. It's not like a lot of um, cooperation or collaboration happens between uh, the emergency staff, especially at my local hospital, and the rest of the hospital staff. So it's very easy that way to, you know, keep certain things silent. I noticed in the course of my time as being a patient advocate on behalf of my family members that went to the hospital from time to time throughout the course of my lifetime, and my own personal advocate, they used to do a thing where when a nurse was handing off a patient, even in emergency, they'd have to do what they call a report. So whenever there was a shift change or something, you had to stand in front of the patient and verbalize what the patient's needs are and what you've done during the course of your shift in front of the patient. So that way, the patient can interject anything that the nurse may have forgotten, largely because, she gets overwhelmed or he gets overwhelmed with the information of all the patients they're inundated with. Well, that policy doesn't exist in my local hospital's emergency room. They do everything on computer. And the patient's not privy to what the report between one staff member to another staff member might be. So let's just say, for the sake of argument, a staff member who may or may not be performing very well in their job can make up whatever they want because they're the ones responsible for inputting what goes on the chart of the patient. So things like difficult patient, aggressive patient can go unnoticed by the patient, but certainly sets a red flag for the incoming nurse or medical professional practitioner who has to deal with that patient. I'm just curious, maybe somebody should look into that, see whether or not foregoing the policy of standing in front of the patient and giving report to the incoming people, or when you're delivering a patient to somebody on a floor, for example, or for a procedure, you verbalize what that patient's there for and why they need that particular intervention, medical intervention. They should start doing that in front of patients again, I think, verbally, so the patient's aware. Or the patient advocate, who's usually a family member, I know it's starting to look a lot like they're going to try to lock down hospitals again in Canada. I, I have a funny feeling that the reason why I was asked when I went into emergency, if I was there on March the 2nd, there might have been, I don't know, some kind of an outbreak of something. Could it possibly be measles? And the World Health Organization? Now that they are really calling the shots for Canada, thanks to Justin Trudeau's appointee going to sign off Canadian civil rights to the WHO, where Canadians have to abide by whatever some bureaucrat in the World Health Organization decides. They did a bang up job during COVID, taking care of the free, so-called free societies and imposing all kinds of draconian laws on the people of the land. I wonder if they're going to be allowed to get away with that for measles or whatever pandemic I see coming on the horizon. I'm just saying, I could be wrong, but I hope they don't try to lock family members from being with their family member in a hospital for any reason, because I have firsthand knowledge of what a patient advocate is. They're basically service staff who volunteer to do as they're told. Because I actually needed a patient advocate at Toronto General, or was it University Hospital, when I presented myself at their emergency one time, concerned about my cardiac arrhythmia. And I was given the all clear, even though bells were ringing. Bells were ringing. But the patient advocate that I got was the same lady who emptied my garbage can. Because I didn't trust my husband, sadly. You know, after 40 years being with somebody who you love and adore, and you don't live together for much of those 40 years, trust becomes a bit of an issue along the way. I'm starting to recover some of that trust again. Thanks be to God. Through prayer, patience, and his understanding of how crazy his wife is. And being willing to keep persevering in what it must be like to be a husband of mine. But I'm grateful to God for my husband. I hope if there's anybody that's prayerful out there praying, please pray that his back injury isn't serious. Calgary, Alberta just got a ton of snow dumped on their parking lot, and there was a whole bunch of people that fell as they were getting out of their cars where he works. And one poor guy broke his leg in 3 places, but my husband landed flat on his back. And he's already got both knees replaced, a shoulder replacement, and fused vertebrae in his spine, because he's a hard-living, manly man who can take a punch or two. So now he's currently in an emergency room, I suspect, trying to figure out what's going on with the click in his bones. I hope he gets better care out in Alberta than the emergency services I got here in Ontario. I'm going to pray. I'm praying. I love you guys. Have a great day.